what industry are we in? If it's not healthcare, what industry are we in? And is this going to be another one of those industries that are going to claim to be a tech industry someday?
The way I see healthcare, it's really a human-centric business. And what I mean by that is that technology, not that it doesn't have a role, but to me, it's behind the scenes of what is really, if you want to use product terms, what is really the product that a healthcare organization or system has, and what is really what the patient is looking for. The digital technology can't be the front and center. What it can do is play a secondary role in how easy it is for that person to either reach who they need to or connect with that physician. But I really see it as a human business. And I think that, one of the things that I spend a lot of time on with the team is research is part of our work. We need to know what people actually want.
What's translatable from a digital perspective, coming from that into healthcare to enable a better customer experience?
I think healthcare, you just said it, right? It's not a commerce business, right? It's not shoes, it's not a product, it's not an iPhone, and you have payers and how that operates. You have regulatory environments and how that operates. And I think all of those things, and there's a slew of other things, physician needs, patient needs, that drive the experience. And that makes it, to me, coming outside of industry, a lot more complex. I think healthcare will continue to operate in a very unique space. And a lot of the things you're gonna get to learn in healthcare, it's gonna be unique in many ways.
Chase, this kind of takes me back to you about the advantages and challenges that patients and healthcare systems encounter with the adoption of digital health tools. I mean, it just sounds so nice, but enlighten us with some realities.
The environment right now is extremely noisy, and it's hard to even filter out innovation of what's good, what's bad, what's effective, what's going to integrate, what's going to create a seamless experience. The other day I was talking to a customer and they said they have 7 different portals that they have to log into for one patient. And you think about that, and at what point do you start to sacrifice that human experience because your head is just down, like logging in new patients? And that's an industry problem. That's an us problem. That's a EMR problem. That's a healthcare problem. Like, everybody is involved in that. And these are really challenging times. So it's how can we impact every single patient for who they are at the right time and for the problem that we're trying to solve for. I do think that the future is bright. I think it starts with conversations like this, breaking down walls. And I think getting in a room face to face, putting pen to paper is the best way to be bold and take a shot. And that's why I love this talk. At the heart of it, it's all about personalization.